Hi, good morning, good afternoon, good evening, whatever time you're watching this. Hi, hello. So, I would like to introduce our group members, the first ladies. Although not all of them ladies, there is one gentleman with us, and we call him as Vicky. And then we have Parvina, we have our international student Zil, we have Tanisha, and we have myself, Claudia. So, for our group, our topic that we have chosen is drugs and its effects on students. So, a drug is any substance that when administered produces a change in the physiology or psychology of an organism. Consumption of drugs can be via inhalation, injection, smoking, ingestion, absorption via a patch on the skin, or dissolution under the tongue. Nowadays, adolescent drug addiction is one of the most serious substance abuse issue. Many teens consider experimenting with drugs to be an important part of growing up, despite the considerable hazards and multiple severe outcomes. Some teens are exposed to substance use through prescriptions and then begin recreational use. Some teenagers began experimenting with drugs as a result of friends or becoming intrigued after listening to a song addressing substance abuse. No matter how an adolescent first begins substance abuse, teenage drug addiction is a very, very real risk.
Hi, I'm Zild Abu. I want to share with you some solution against illegal drugs. Actually, we have a lot of things we could do to ourselves to avoid this most unnecessary thing. So let me summarize and share with you what I've got from different references via Google. Let's start from mass and media campaign, demonstrating through media, billboards, television, newspaper, radio, those negative consequences that we might get if we're gonna be involved into illegal drugs. Another solution is community training. This is very important because we don't only help ourselves but also we help other people and our society about this to avoid this illegal drug. Next solution is family training, counseling, and case management. Family is very important, so we must maintain the relationship with our family, so we always in the right way of life when we are into our families, especially our parents. Another one is classroom instruction. So let's always listen to our teachers and mentors because they will give their best to guide us for our future purposes. Next is cognitive behavior, strategies that reinforces external to the student to shape behavioral act, to recognize the physiological cues, experience the risk of the illegal drugs. So another solution is mentoring, recreational community, school discipline, establishment, classroom and instructional and management, and of course regrouping the student. So these are some solution that we might do for ourselves to avoid the illegal drugs. I hope you guys learn from what I have shared with you, and let's always say no to drugs.
My name is Tanisha. So, truth bites as we hear about the high prevalence of opioid dependency in secondary school. School is intended or believed is a safe place for students for not approaching the bad and dangerous side issues, such as drugs. But nowadays, the atmosphere and surrounding changes as the time does. Recently, on 12 September 2020, popped out a case related to drugs involving 177 students in Johor Bahru. They were undergoing tests on drug usage. Revealed the result as positive for those 177 secondary students. Moreover, shockingly, there were cases of students linked involving drugs. State Education, Information, Heritage and Culture Committee Chairman Muslan Puja made a closure to this case, which he had said the number of students as part of 10,132 from 4 and 5 students from 280 schools across the state who were tested for drug abuse. The demanding drugs were synthetic drugs. Last but not least, a 15-year-old boy was also related to one of those drug cases among 215 people during the movement control order. Parents and educators play an important role in molding the students and nurturing them.
So now we talk about the effects of drugs on students, especially on their body. So, any drug that is smoked can affect the heart, causing diseases like emphysema, lung cancer, and chronic bronchitis. Breathing depresses morphine, which can worsen asthma. Stimulants such as cocaine are particularly rough on the heart, causing injury every time they are used. Long-term heart disease like heart failure may result from stimulant misuse. Injectable drugs such as heroin can cause pains and even infections in the heart or blood vessels. Many medications like kidney failure, which is life-threatening, will cause long-term kidney damage. This is activated by high body temperature, muscle tissue deterioration, and dehydration. And now we move on to the effects of drugs on the brains. Drug addiction induces memory and learning shifts, actually conditioning a person to crave drugs and take them, cues the setting of a human function as stimuli that make them desire and reflexively want a drug. Typically, certain medications are poisonous and they can destroy brain cells. They will never come back to life with these cells because the damage is lasting. Drug misuse is impacted by another neurotransmitter involved in the reward system, glutamate. The effort by the brain to compensate for that creates changes in how a person learns, making it harder to understand and learn. So, drugs also has a psychological effect. Along with mental illness, substance misuse and addiction also emerges. The idea that the risk factors for both are similar can explain this, but there is also evidence that substance misuse can induce, contribute, or worsen mental health problems. People who misuse medications are twice as likely to deal with mood problems, including depression or anxiety disorders, according to research. Drug addiction can cause any psychiatric disorder or make any disease worse, but anxiety and depression are the most prominent and lifelong mental health condition arising from drug abuse. Death is the most serious possible long-term consequence of misuse of drugs and drug addiction. Over time, medications can kill slowly, but they can induce a fatal overdose as well. The diversion of any form of prescription places an individual at risk of an overdose that could be fatal. When using street drugs, the risk increases because the intensity or purity is impossible to know. Combining drugs that depress ventilation, such as opioids or sedatives, for instance, dramatically raises the likelihood of a fatal overdose.
Hi, my name is Parvina Vasudevan. Today I'm going to talk about factors of drugs. Factors of drugs rely on many purposes. First and foremost, it's anxiety and depression. Both can be classified as chronic disorder or acute issues. Anxiety and depression greatly increase the risk factors of starting drugs, but also influence drug usage by making the person more susceptible to other factors. For example, self-medication or taking drugs. To feel better or to forget about issues is a common reason, but the issues also make users more open to peer pressure, more likely to feel hopeless. Secondly, it relies on loneliness. When an individual is lonely, the individual is significantly used to drugs and alcohol as a solution to feel better. If an individual has strong relationship with family and friends, they are less likely to become a drug addict.